The PRISMA checklist, the contents of your systematic review. So what exactly is the purpose of this PRISMA checklist? So the purpose of the checklist is to provide standardization for systematic reviews, provide transparency for the reader, establish a scientific rigor, ensure complete reporting, and it also is a tool for critical appraisals of systematic reviews. This is your PRISMA checklist. If you have not done so already, please print out and follow along during the lecture. The PRISMA checklist is a 27-item checklist. It specifies the contents of a systematic review or the meta-analysis with some elaboration. However, for more details, please check out the PRISMA explanation and elaboration document for more specifics. This is uploaded in week 2 of this course. So let's start with item number 1, titles. Catchy titles. One may often think that one wants a catchy title to draw the reader in. However, this is not the case for systematic review or meta-analysis. So stop before you get to some great catchy title for your review. Instead, you want your title to convey important information for the reader. Instead, you want your title to identify your piece as a systematic review or meta-analysis or both. Your title is going to improve indexing and identification of the article. You may have found this true when you were looking and doing your own search. You want to include as many pieces of your PCOS as possible. You want to give key information about your approach. We're going to use the following 3 examples in the next couple of slides. These are the 3 examples we're going to use. Chemotherapy in adult high-grade glioma, a systematic review and meta-analysis of individual patient data from 12 randomized trials. Number 2, diet or exercise intervention versus combined behavioral weight management programs, a systematic review and meta-analysis to direct comparisons. And 3, association of all-cause mortality with overweight and obesity using standard body mass index categories, a systematic review and meta-analysis. First, you want your title to identify if this is a systematic review or a meta-analysis. You can see in the following 3 examples that each have done so. Your title also may include other elements of your PCOS. For example, in the first example, it identified adult high-grade glioma as part of the population. Or the following 3 examples all specified the intervention being studied, the chemotherapy, or diet or exercise interventions, or standard body mass index categories. The second example specifies the comparison group. So it's diet or exercise intervention versus combined behavioral weight management programs. The third example includes the outcome in the title, so association of all-cause mortality. Your title may also include information about the type of design that you examined, or more specifics, how many studies were included in the final analysis, as in the first example. Number 2, abstract. The abstract is a structured summary of the background, objective, data sources, study eligibility criteria, participants, interventions, study appraisal, synthesis methods, results, limitations, conclusions, implications, and may also include the systematic review registration number. It may help to organize your abstract with suggested headings, such as context or background, objective or purpose, data sources, study selection or eligibility criteria, study appraisal and synthesis methods, or data extraction and data synthesis, results, limitations, and conclusions. But you do keep in mind that it must comply with your target journal. For example, data sources, study selection or eligibility criteria, and study appraisal and synthesis methods, or data extraction and data synthesis, may all go under the heading review methods. And remember, it must all comply with the selected target journal. So look at your target journal and look at a couple of systematic reviews in the most recent years and see if your own manuscript can follow that format. So yes, at this point in the course, your abstract is still a work in progress. So moving on to the introduction. You want your introduction to include why you're doing the review, why the selected population, that intervention, that outcome or comparison, why the eligibility criteria, what it is about the years that you've chosen to review. You want to put this in the context of what is already known. You want to identify the gap in the science, and you want to identify how this systematic review or meta-analysis will add to the science and advance it. The second part of your introduction, you want the objective statement or your purpose statement. This is the explicit statement of the PICOS. You want the population or disease, the intervention or exposure of interest, the comparison or control groups, the outcome or endpoint of interest, and the study design. And usually this is done in one sentence. Methods, the protocol and registration. The protocol specifies before starting the objective and the methods. This reduces bias and it improves replicability. You also want to indicate where the protocol can be found. For example, is it in the appendix? Has it been published elsewhere? Is it registered? The Cochrane Handbook gives a good examples of protocols. Also, you can register review at the Center for Reviews and Dissemination or the Joanna Briggs Institute, to name just a few. This is also where you can check to determine if your review is being done currently. The protocol that you may refer to in your manuscript text may include the background, objectives, methods, criteria for selecting studies for this review, the types of studies, types of participant, types of interventions, types of outcome measures, the search methods for identification of studies, data collection and analysis, and it also includes acknowledgments, references, other references, additional references, published versions of the review, tables of figures, additional tables and figures. For your methods and eligibility criteria, first of all, you want this explicit. This shapes the search strategy and study selections. You want to include study characteristics, including the PICOS and follow-up, such as study design, example, randomized controlled trials only, intervention characteristics, do they have to have standardized protocols, specific outcome measures, example, hospital admissions, death. You also want the report characteristics or the article characteristics. In your methods, you want to include your information sources. This is all the databases that you use, any contact with study authors that you conducted, any reference lists of selected studies that you look through, any consultation with experts. You might want to mention you looked at any regulatory agency websites, any unpublished material that you included in your review. You want to list who developed and conducted the search. Often you'll see initials of the research team members. You want to list the search dates. And there's some good examples in the PRISMA elaboration and explanation document referred to earlier in this lecture. For the methods, the search section, you want to present a full electronic search strategy for at least one major database, including the limits. Name the search terms you used and the Boolean terms. This needs to be, again, replicable. Consider referral to a protocol or appendix with search strategy. You want to ensure that your search strategy ensures rigor. For example, is there a peer review? Methods, study selection. How were the studies selected? What was the selection process for screening, determining eligibility, and for inclusion in review? How was it screened? Was a title in the abstract looked at, or perhaps it was a full text at that level? How many reviewers participated in the screen? Who were those reviewers? Again, you can put initials in parentheses. What was the level of inter-rater reliability if you had more than one screener? How were disagreements about inclusion resolved? Here is the PRISMA flow diagram. This takes you through each level of the study identification. So the first part is the identification through the database searches, and then you have the screening, which ones of those are kept, and then you have the eligibility of those full texts that you indicated you needed, which ones are still eligible, and then finally the included studies. In your methods section, you're also going to specify the data collection process. What was your method of data collection? Did you use piloted forms? In this class, we've gone over the use of the matrix and establishing categories and what those categories mean. Again, if you do have a published protocol or a registered protocol or a protocol index, you can refer to that protocol. What were the number of data collectors? Who, again, were they in parentheses? How was the data collection validated? Did two reviewers look at the same studies? What were the methods used to determine duplicate studies or duplicate databases? What was the method used for obtaining or confirming data from investigators if you were using sources that were unpublished, particularly when something was unclear? In your methods, you want to indicate which data items were extracted. These are the variables, your systematic review variables that were extracted. These are basically the matrix categories that you've determined, and then what those matrix category definitions are. You want to indicate any changes from the initial protocol and, again, rationale for those changes. And you also want to identify any assumptions that you've made if the studies were not explicit in their definitions. Some of these examples. In the methods section, you want to indicate the risk of bias assessment. This was often called a quality appraisal, but more accurately, it's describing the impact on the bias. How was a bias assessed in individual studies? Were there raters? Did they look at the outcomes or the study design, randomization of the study, blinding of the sample or healthcare providers? Was there loss and follow-up? How was this risk of bias synthesized? If it was not done, why was it not done? What quality appraisal tool was used? What is the main summary measure? State the principal summary measures. Was risk ratio used, odds ratio, difference in means? Again, you're looking at the primary outcome measure. State that summary measure. This is particularly relevant in meta-analysis. Planned method of analysis. How will your data be synthesized? Again, this is most often needed with meta-analysis, but it is also used in systematic reviews. You may choose to categorize your variable by theoretical foundation of intervention or categorized by level of treatment center. How are you going to synthesize all of these studies? What is your risk of bias across the studies? So you have assessed the risk of each study, but how is there a bias across the studies? For example, what would occur over cumulative data collection? For example, would it be published data, the tendency to publish only positive results, selective reporting across studies? And what does this mean for your analysis? You may have a statistical measure to assess bias, but this is beyond the scope of this class. In the methods section, you also want to discuss any additional analysis. What analysis will you be doing? For example, you may do an analysis by subcategories, by gender, and you want to include this in your plan. On to the results. You first want to start off with your study selection. What were the number of studies screened? What were the number assessed for eligibility? And finally, what were the studies included at the review at each stage? Again, refer to the flow diagram. You want some of this information in text and also then reference the flow diagram where there's more information. Study characteristics and bias. For each study included, you want to present the characteristics and provide a citation. For example, you may compare the different study sizes for the studies you included, or you may do it for each variable of the PICOS, or you may do it for the follow-up. Again, for each study included, you do want to present the risk of bias. The results of individual study and the synthesis of such results. You want to mention each outcome and then give simple summary data for each intervention group. You want to include the effect estimates and confidence intervals by a forest plot. Again, you may want to include a table such as the one listed below. And then you want to talk about the main results of the review. And you want to be very systematic about presenting these results. You also want to present the risk of bias across studies and any additional analysis results. So again, it's the results of analysis of the risk of bias, in a summary, what happened or what is more likely to impact the results. And then again, you're going to present the results of any additional analysis that you had planned. For example, your subgroups or sensitivity analysis. And again, you want to make sure you report even if no significance. And finally, we're at the discussion section. You want to provide the summary of evidence. You want to summarize the main findings, include the strength or effect size for each main outcome. Be brief, make sure you're balanced, and then give a statement on the overall strength of the evidence. And then, of course, you don't want to give relevance to key groups. What kind of implications does this mean for policymakers, clinicians, patients? And of course, as in any study, you want to discuss limitations. You want to do this at the study level, at the outcome level, what was the bias, and at the review level. And again, you want to address validity of your systematic review. Conclusions. You want to put in a general interpretation of the results. Put it in greater context of other evidence. Return to your background points and make sure you address those. And again, you want to be specific in your implications. What is the implications for practice, for policy, for research? And make sure you don't overstate the results. In other words, you don't want to imply that your results from the systematic review mean more than the limitations allow. And finally, a systematic review should include funding sources. You want to describe the source of funding or other support. And what role did those funders have in the systematic review and the results? You want to make sure that you are as transparent as possible and assess any biases this may implicate. Again, for this class, most likely you have not had funding to do this systematic review, unfortunately. That is all for the PRISMA checklist. Do use this as a source. Your reviewers will probably use this to review your systematic review. And keep working on the parts that we've already completed, including the introduction, the background, the methods, and now we're starting on the results. Good luck!